Hey everyone, I want to give a quick video. Abel has a lot of followers, and I know that a lot of you have had questions and concerns about why Abel went to Boston Children's Hospital this weekend. Most of you who follow us know that Abel is at home, and with his tracheostomy, he has a trach, and he's on ventilator support around the clock. So over the weekend, and it's still the weekend, I guess it wasn't over the weekend, it was during the week. Mom's a little exhausted, so we tried catching up on sleep today, and we were able to nap, and that was really cool. Abel signing that he's happy right now. You happy? Yeah. He's a big old flirt. I keep trachs that I use to talk to people about what is in Abel's neck. So that people can sort of understand when we talk to them about Abel having a tracheostomy. So over the weekend, he has nursing at night, which we're very grateful for. His trach ended up coming out by the time that I had come into his room. I didn't know that his trach was out of his neck, and so he wasn't getting ventilated, and his ventilator was going off. However, anybody that has a ventilator at home, or for those of you who are nurses or nurse practitioners, physicians, the ventilator doesn't say to you, hey, look, the trach is out. So I was asleep. My first thing should have been to see if his trach was in his neck, but I did my eyes on him, eyes on his equipment, and eyes back on him. Started to bag him, and when I say bag him, it means I'm trying to give oxygen to him, as though when you resuscitate somebody, you know, you see typically putting a mask over the face, and for Abel, when his trach is in, we just bag him with his trach, and we're able to have a little attachment that sort of pops right on, and you're able to bag. So I was bagging him. His chest wasn't rising. It was probably, Abel spent 11 months in the ICU, and this was the worst way that I've ever seen my child. And Abel's 2.5. We've been through a lot of shit at home. Lots of puns intended there. He's a kiddo that needs support, and so we've gone through a lot of ups and downs being at home, and a lot of scary situations, and a lot of progress made developmentally and with his overall health status. So obviously I'm shaken up over it, and going forward we're gonna need to come together and discuss a better plan to get him to the ICU faster than he was. By the time that I realized the trach was out, this is what Abel's trach looks like. Typically doesn't have this piece. So this is the outside that you see on Abel that's attached to his ventilator tubing. This little piece hangs on the outside of his neck, and what this does is it holds water that goes, this is the piece that goes on the inside of his neck. By the way, this is a trach that I've cleaned and keep at home, like I said, for educational purposes. But what you do is you fill this, and it inflates a balloon that goes in his trachea, and it creates a seal between the trachea and the trach tube here. So it gives him proper ventilation for his needs. So these are trach ties. This was around Abel's neck, and when I was bagging, his chest wasn't rising and falling because rather than being on the inside of his trachea, the trach tube had come out. So I had to take the water that was in the balloon here into the cup and remove it, and I had to reach for a metal obturator to guide it back into his neck. I was able to secure the trach, get it back in, and start bagging him and see his chest rise and fall, which was a miracle. And I'm really happy that things turned out the way that they did, and that he was alive, because I had the split second in my mind where I didn't think that he was going to make it. So that's what went on over the weekend. We're doing fine, well. Abel's happy. He's a little bit junky since we've been home. His secretions are a little bit thicker because he was out of his environment, but we were in and out of the ICU in less than 12 hours. It was nice to see our family there. They've taken such great care of us, the nurses, the physicians, surgeons, everybody. And we had a really positive experience with the emergency room department down there, which was nice because we haven't had to use the emergency department at Boston Children's Hospital. So that is our update. I just wanted to let everybody know that, you know, I share a lot of the milestones Able makes and sort of some of the frustrations and advocacy work that I do on my end for Able and patients like Able to try and outreach and spread awareness for Abel's condition, his Cornelia de Lange syndrome, his CDH, his hypertension, when we were withdrawing meds at home, or weaning meds at home. So I like to share a lot of that to just reach people, and some of you have been through it, some of you haven't. But we are so grateful to be home, and just being back in that environment makes me really appreciate that we were able to come home at all. And for those that are still in the hospital, in the ICUs, and are fighting the good fight, you guys are in my thoughts, and I want to sincerely thank everybody that was a part of getting Able taken care of, and I'm glad I was able to get to him in the right amount of timing to get his trach tube back in, and I'm grateful for my husband for flying in from his full-time job down in Virginia and being there for us and giving Able and I the day to bond. And he slept in our bed last night. We're not co-sleepers, but it's, you know, hearing just his respirations on the ventilator and seeing his chest rise and fall is the most beautiful thing in the world. And just love your loved ones and hug your kids and hug your family and be appreciative for the little moments and the breaths that they take. And thank you all for continuing to support us. We love you guys. And you will say thank you. You're happy, huh? You're happy to be home? Can you say happy? Tell Mom happy. Tell Mom happy.